So thanks to everyone for a really excellent session. I have the honor, I suppose, of asking some questions of everybody here and trying to tease apart some of the issues that people brought up in the various presentations that they made. And the one that I want to start with was what I thought was something that was incongruent between Art's presentation and Stephen's presentation. And I'm interested in hearing from both of them about why they think this is the case. In Art's presentation, we saw him describe the benefit that Magna employees have in Canada versus the United States and the use of really sophisticated cost control measures like tiered formularies and more negotiation on prices and pharmacy networks versus the Canadian plan, which in comparison was quite simple and straightforward. And Stephen pointed out in his presentation that that in their experience there hasn't been the demand from Canadian employers for these plans, and when they're shopped around, they're not purchased. And I'm wondering, so Art, from your perspective, do you think there actually is a demand and they're just not being offered in the right way, or Stephen, what are the roadblocks and why aren't people moving forward on these more sophisticated designs that we see south of the border?
Well, I would agree with Stephen that most Canadian employers that have private plans are very slow and cautious to try anything new and dynamic. Magna International is somewhat of a maverick. I mean, because of the industry that we work in the automotive industry, and we're in a global market, and many of you with your business models may be in global markets as well. And what that means is we're no longer competing with somebody down the street or in the next province. We're competing with companies all over the world. And fundamentally, it's all about keeping jobs in Canada. So we tend to look a little bit closer. That's why we have a tiered formulary. That's why we have some of the things that I showed you we do have. I would say that most of the Canadian employers are not even near there. They have an open formulary, 100% payment right now. I know that's at least half of them, if not more. And it's just simply because that's the way it was set up, and they just let it run that way. We've been challenged in our business model to have to try to save jobs. I think 08 and 09, with what's known as the Great Recession, hit us very hard. We lost 5,000 jobs, 5,000 jobs in Ontario, and they're not coming back. We were over 22,000 employees in 2008. We're now just over 17,000 in 2013. We're growing a little bit, but most of our growth is actually in other countries. So we are a little bit more willing to adapt, and I would agree that I have worked with lots of other employers, colleagues of mine. I'm not going to name the companies, but they're large employers. They like the ideas, but they're very cautious. They just don't want to rock the boat, and their business model may be completely different than ours.
I would agree. I think the challenge an employer has is people love their drug coverage. It tends to be the thing that they value most. People are going to be extremely sensitive to perceived changes in that, and people, for better or for worse, are going to consider step therapies, generic substitution as a restriction of choice. They're going to consider that innately to be a pullback. And when you've just gone through 5 or 6 years of continual pullbacks, salary freezes, layoffs, changes to pensions, closing your DB plan. I mean, just continual drip, drip, drip of bad news for what at the end of the day is still maybe 1.5% of payroll. Are you going to risk upsetting 1,000 employees to save yourself the margin by putting some of these things in place? That's the calculus people are making, and they're not quite there yet to make the big move. But there is going to be a tipping point, and everyone thinks that costs are going to start going up again over the medium term. And so, you know, where does the mass of people's willingness to change, when does that switch over? I guess we'll find out. But the carrier's perspective is we need to be ready to be there when they're ready for that move.
Yeah, and I just want to add to that. The changes we made, some of them were very difficult. Like when we capped dispensing fees at $8, where before there was no cap, people could go wherever they wanted. And we just simply said, look, we're not hurting you. We're just driving consumerism. We communicated very clearly. We took mail codes, and we showed them pharmacies and published what the dispensing fees were. And this is readily available, public information. And we just simply, when we have to make a change, we over-communicate and over-inform and over-educate that it's not so much a takeaway as just it's a change in what we're doing, and what we're trying to do is save jobs for you and for others, and to make us more competitive. So, but they are conceived as takeaways if it's any kind of a change from what the norm was before. So I think it's all about how well you communicate and educate. And I've talked to colleagues who said, well, you know, we have no need to do that. Why would we want to do that? And I always want to tell them, well, give me 10 minutes with your CFO and let him know or her know the kind of money you left on the table that didn't need to be spent, just by simply driving small changes. Because when that tipping point comes, so many employers are going to be unprepared because they haven't taken small incremental steps with their design or managing their costs, that they're going to have to do something drastic, and then it's going to be a real problem.
So I'm going to turn now to a question for Marie-Claude. The idea that you talked about, where you were moving from to a benefit that was general rather than universal, I found quite interesting. And but Quebec got it done. Quebec does cover everybody. Quebec has the lowest rates of people in Canada that can't afford their prescription drugs. And it was possible, whereas in the rest of Canada you still see the same gaps and the same omissions. Is it worth it?
Actually, one has to understand one thing about the Quebec plan, which is not well understood, I think, from even in Quebec. The organization between a public and a private, this kind of division of labor, if I may call it that way, for covering everyone and financing through the private insurance scheme with deductibles and premiums and all that, is a bit of a misnomer to a certain extent, because actually when we look at numbers, we see that the public system is financed only up to 25% through that sort of financing, which means that it's highly and therefore it has to be financed through the general revenue of the state, you see. So my observation on that is that how sustainable is such a system in the long term? So is it worth it? Well, it's certainly a great gain to have everyone covered. There is no doubt about that, and that's why I started, with the advantages of the plan. But are we in a dead-end road where we will face and have to, question basically the structure of the system if you can't, finance it on the long term? So that's the question that I put on the table. Sorry to answer your question, Mike.
That's okay. What's the answer? Are you on a dead-end road?
I think we've got to face the question and have this, how do you say it? We should have this conversation, but it should be a conversation or a discussion or a debate where the coverage of everyone would not be compromised, but where we have to think of the collective advantage and not only the individual advantage where everybody is covered. And that's what we didn't have yet.
So, Art, I'm going to ask you another question based on something that you said in your answer to the previous question. You talked about Canada being one player in a global marketplace for employment, and you being a global company. Mm-hmm. I grew up in a city that got a Toyota plant when I was young, and the Toyota plant, one of the reasons that they said they were going to locate that plant in Canada was because that they didn't have to pay the healthcare premiums for their employees. Do you think that were drugs to be publicly covered, that it would make Canada more attractive to employers, or do you think that that's a false claim?
Well, it's all about cost at the end of the day. Someone's going to have to pay. So whether it's funded by the government or the system that exists today, if it's totally funded by the government, I think there is some economies of scale there and some better management that can be done. If it's truly a universal plan, which is what's been talked about, I personally would be all for it. I think it would be attractive for business to be in Canada, because it's very hard to manage a cost that you don't know what that cost is. And currently, we don't know what it is. We're on an ASO basis, and Steve mentioned that. It's complex. On an ASO basis, it's variable cost. It's hard to budget. You budget with what you expect to have versus a fixed cost. So we would much rather pay a fixed cost. It's predictability of accounting. It's more manageable. And I think it would be better managed myself. So I think, from my own personal opinion, I think it would attract business.
Stephen, do you want to respond to that from the perspective of the private insurers? Why should Magna want to stay with a private insurance plan versus
Well, I can't
public
speak
plan?
for Magna, so
Okay,
I'm not even gonna try.
why would a general Canadian employer of about 17,000 employees want to?
Well, Magna,
I'm,
yeah, so look, Art's point is well taken. The costs are going to come one way or the other. And I would say we need to be careful with the assumption that a centralized, government-run pharmacare program is going to be well-managed and cost-effective in the long run. I think we have to be careful with that assumption. We need to have incentives that challenge people to do new things, and you get that kind of thing with a bit of a mixed system. What I would say is you need to look at the outcomes you want to achieve and then look at innovative ways of doing it. The Medicare system in Canada today, universal and publicly funded, is a relatively expensive one that gives us relatively mediocre outcomes. That's the reality, right? So why would taking that system and saying, without any change, it's going to work well in the pharmacare world? I don't necessarily know if that's the case. So systems, when I look around the world at Europe and other places where you've got universal coverage, they have an element of public and private. They've built it that way as a system. Mm-hmm. I think we should challenge ourselves as Canadians to start having those kind of discussions as well.
Can I respond one thing on that?
Of course.
I mean, I hear Stephen, and at the same time I hear and I read what was given as an argument when the Quebec Pharmacare program was implemented, saying that it is important to have both the private and the public because there will be this incentive, as you mentioned, that one looks to the other and they will both be efficient and compete, to present the best practices. Well, I look at the system and it's nonsense because they can't compete anyhow. The system makes it so that the patients anyhow can't go from one to the other. And there is systemically no reason and no mechanism for this kind of competition and incentive to go on.
And I'm not saying the Quebec model is the right one.
great.
Okay. But the Quebec model can be enhanced to allow for that kind of jumping back and forth. And
I'm
to
sure
your
many
point,
people would like to hear
discussions
that.
The bell has gone, the round is over, I'm afraid.